Welcome, I'm Pamela McShane. I'm a pulmonologist from the University of Texas in Tyler.
Hello, I'm Christopher Richards, a pulmonologist at the Massachusetts General Hospital.
Hi, I'm Michelle Apicella, and I'm a physician assistant at the Cleveland Clinic.
So thank you all for coming today. This lecture, we're going to be talking about the importance of tracking exacerbations in bronchiectasis. The first thing we really need to understand is what is an exacerbation? So the clinical consensus definition of a bronchiectasis exacerbation is the increase of 3 or more symptoms over the course of 48 hours that leads to a change in therapy, either antibiotics or an increase in the frequency of a baseline treatment. The other way to think about an exacerbation is the patient's reporting of symptoms, and if the patient's symptoms rise to the level of that exacerbation. I really believe that in this condition, patients know themselves better than anyone else, and when they call me and tell me I don't feel well, that's a real reason for me to take that seriously, speak with them, engage with what is going on to make them feel unwell. And if the two of us agree, then we may implement a new form of therapy, either antibiotics or a change in their chronic airway clearance regimen. I mean, Dr. McShane, do you have a similar sense, or do you have a different approach to what defines an exacerbation?
Well, I agree that, certainly there's that published definition of exacerbations: increased sputum, increased cough, increased purulence of their sputum, hemoptysis, chest discomfort, and fever. But it's really important that, because once I often will ask my patient, have you had an exacerbation? And they actually don't know what an exacerbation is. So I think we're missing a lot of exacerbations, which is really important because exacerbations are, whether the patients know to diagnose them or not, they're really important events in the course of our bronchiectasis patients' lives. Bronchiectasis exacerbations are associated with a decline in lung function. Certainly at the time that they're having the exacerbation, we see this decline in lung function. But unfortunately, that decline or that loss of FEV1 can be permanent. And that's an important, disease progression. So the recognition of that exacerbation is important.
Exacerbations are the real focal point in the chronic management, as you said, both preventing them and treating them when they arise. Early recognition is part of that, and one of the things that goes into that is trying to figure out what the common causes of an exacerbation are. So, this can be just about anything. I mean, it might be the acquisition of a new bacteria in the lungs, so that's why we're so focused on getting sputum samples for our patients. It could be a viral infection, right? It could be COVID, it could be influenza, it could be any number of just the common colds that then set off more inflammation in the lung, more mucus production, and then begin accelerating that vicious vortex. It could be poor air quality, right? It could be excessive soot from wildfires that are coming into the country, which if people have like a asthmatic underlying, that could set off the asthma, which then leads to a flare-up of the bronchiectasis. And it also could be non-compliance with treatments. So next, let's discuss some risk factors that increase the likelihood of exacerbations for bronchiectasis. And those could include things that are from outside of the patient, but it also could be things that are happening within the patient. Maybe they have a chronic infection with Pseudomonas, which will absolutely increase the likelihood of having an exacerbation. Maybe, as we said, it's a drop-off in the adherence with the airway clearance therapy. Maybe it needs to be advanced, and maybe it needs to be enhanced from what it has always been. And also, but one of the biggest factors is an exacerbation. One exacerbation is going to increase the risk of having a second exacerbation. And that is really frustrating for people, where they will get sick, they'll come to the office, we'll prescribe a treatment, and then as soon as those antibiotics stop, or within a few weeks, the symptoms are all coming back. And that's also very challenging for providers, as we feel like we might be running through our toolbox faster and faster than we would like. And so those are the kind of things that we really need to think about when a patient comes in with an exacerbation. It's not just how are we going to get out of this exacerbation, but how are we going to get out over the course of preventing the next one down the line, which is a really high-risk period. Dr. McShane, will you be able to take us through how exacerbations in bronchiectasis lead to progression and worsening of the disease over time?
So this is really bad, not only because bronchiectasis exacerbations are bad in isolation, but bronchiectasis exacerbations can contribute to a loss of lung function. During that exacerbation, patients will drop their FEV1. We see this in the clinic when we measure their spirometry. But unfortunately, that lung function can be permanently lost. They can come out of that exacerbation having lower lung function than where they started. And certainly over time, this is especially concerning because after 5 and 10 years, they've really lost some substantial amount of lung function. If they have a lot of exacerbation, that's accelerated. A loss of lung function has downstream effects that are independent of just what we measure in the clinic. In my experience, if a patient loses progressive lung function, they're less likely to exercise, they're less likely to be able to live their lives as a normal person, and that has downstream effects because we know that a person must stay active to be healthy. In addition, we know from data that bronchiectasis exacerbations lead to exacerbations. So patients who have frequent exacerbations are more likely to have frequent exacerbations in their next year. And then finally, patients with bronchiectasis exacerbations have a higher rate of mortality. So it really underlines the importance of preventing these events for our patients. So Michelle, we've talked about the importance of exacerbations and how detrimental they can be in the lives of our patients. So can you speak to how you track these events and how you kind of keep track of everything?
Yes, absolutely. I think it's so important at each visit with our patients with bronchiectasis to be asking about, when was your last exacerbation? When was the last time you needed antibiotics? And oftentimes I do ask about prednisone use as well, not because prednisone is necessarily needed for bronchiectasis exacerbation, but we do know that our patients are also going to primary care providers, express cares, and they're getting prednisone very frequently for their symptoms. And so I kind of use that as a gauge of whether they were in an exacerbation or not.
And to be clear, I think you're saying between the lines, is that prednisone is not recommended for the treatment of bronchiectasis
Correct.
exacerbations unless they have asthma.
Because we do know that prednisone use can increase the risk of infections and NTM disease. So it's very important to have frequent follow-ups with our patients who have bronchiectasis exacerbation. So if I'm seeing somebody in the clinic who has a bronchiectasis exacerbation, I like to see them for quick follow-up, typically within 4 to 6 weeks later, make sure they're getting back to their baseline. If somebody does have frequent exacerbations per year, we're seeing them more frequently in the clinic, maybe every 3 months or so. If somebody doesn't exacerbate as frequently and have more stable symptoms, we typically follow them every 6 months or so.
I agree that that's a very similar tempo to the follow-ups I try to achieve. I have to say that I could not do this work without the nurse practitioner that I work with every day, because it's just with these frequent follow-ups and needs for multiple studies over the course of a year and triaging phone calls, it's a lot for one person to handle. It just would not happen without working with my APP. So, Dr. McShane, you and I have had conversations before about trying to think of ways for patients to track their symptoms, monitor their symptoms over time, so we can have a better understanding, or they can have a better understanding of when an exacerbation is on its way. Because if you have chronic daily symptoms, how do you know if that's a normal up and down variation day to day, or if that really is a change over time?
It really is one of the biggest challenges. And I know that the patients also feel this way. And I think it's a lot of what you just said that's picking up the phone, talking to your patient, and really understanding what their life has been like.
It's very important to educate patients on bronchiectasis exacerbations and how they should be able to track exacerbations as well. And as we've already discussed, exacerbations can really be burdensome to patients, not just emotionally, but can lead to hospitalizations. One of the things that I do for patients when they're in the clinic is on every after visit summary, provide them information. This is what an exacerbation is. This is what the symptoms are, when they should call us and things. And I do stress to them, don't ever hesitate to call us. We're never, like you mentioned, we're never going to be upset, if you call us. So it's very important.
We really need some type of monitoring system that we can kind of keep track of our patients' symptoms from a day to day. I think that would be helpful.
So one of the tools that patients can use to monitor their symptoms and track exacerbations is the Bronchiectasis Action Plan. This is a tool that will allow patients to record what their chronic therapies are, what constitutes their airway clearance, and then also allows them space to record if they're having a change in symptoms, to track for how long those symptoms have been above their baseline.
Yes, I'm really excited about the Bronchiectasis Action Plan because similar tools have been really successful in CF. So now we finally have one for bronchiectasis.
We know timely intervention in bronchiectasis can lead to better impact on patients. Timely intervention may significantly reduce burden of exacerbations and improve overall outcomes in our patients. Not only should our patients, but us as healthcare providers should prioritize tracking exacerbations. And I do want to thank Dr. McShane and Dr. Richards for joining me today. And thank you for listening.